is a question from a student support perspective. How do you recognise it, ADHD? What would be a range of symptoms that you would look for to say, this could be?
The main thing is there's a website that I can direct you to. It's a Canadian website. It's called caddra.ca, caddra.ca, and they have a World Health Organization 2-minute questionnaire, which is like a ADHD symptom scale. But in a nutshell, the first 6 questions are to do with examples of impulsivity, inattentiveness, poor attention. But the questionnaire only takes 3 minutes to do, and it gives you a suspiciousness that this is what you're dealing with. I could actually email you one, and you could disseminate it if you like, because it's in the public domain. It's not a medical questionnaire at all. I mean, anybody could get some use out of it.
And that would be a useful tool for staff.
Yeah.
Support to hand to a student, say, take a look at this.
Yeah.
Yeah. Okay.
And basically, the more sort of over to the right all of the time answers to the questions, the more likely the person is to have the ADHD, and at least it gives them a good evidence base to take it to the GP, who would then refer them to a psychiatrist. Because the way the health service works, GPs with adults can't initiate stimulants. It has to be a specialist recommendation. So they have to get seen at some point by a psychiatrist. But it's things like you've got your hyperactive ones who can't sit still in the chair, who don't have that focus, that they kind of drift off after 5 or 10 minutes, whether they're watching a movie, listening to a lecture. And then at the other extreme, you've got your inattentive sort of daydreamers, who just things sort of wash over them. And oftentimes, I don't know if you remember that comedy series, Little Britain, where the bald-headed comedian plays the ADHD girl who, yes sir, no sir, but everybody has that image of her. She's your archetypal ADHD type of person. I think sometimes it's helpful to have a few caricatures in your mind as to what these people might be like. But that's the sort of hyperactive extreme. You've got other people that are more your daydreamers.
Right. I wrote down 2 or 3 things. I was curious. You mentioned a medication which is used for narcolepsy.
Yeah.
You said that both over the internet. Is that? I mean, legally both over the internet, or is it something that's? No. Okay.
No, it's. I mean, nothing of that kind can legally be purchased in the UK over the internet, but they are sold overseas, and what happens is in small quantities they're not necessarily intercepted by customs. If they don't think the person ordering them is a dealer, then it kind of escapes. So it is possible. And then obviously the other thing is these things are available on the street usually, because people realize they have a street value. So person X gets a prescription, doesn't use it, and then sells them. Yeah. Now, in a conservative, in quotes with a small c, city like Inverness, I don't actually know if there's a street market for modafinil. But it's certainly the case in London. I went to a neuroscience conference in April that Professor Nutt was chairing some of the seminars, and he's one of the top kind of government pharmacology advisors, and he was certainly talking about a number of campuses in London where use of this type of drug is rife, because we actually had some ethical set discussions about whether this actually is okay or not, because you get to a point where if so many students are doing it, what's the debate? Does that make it right? Is it fair on the students going into exams that don't use these things, contrasted with the people that do? It's kind of a developing issue, to say the least.
Yeah, quite. I wrote down basic first aid with students, and I'm thinking, Caroline, the cadet program, I'm quite sure that basic first aid is a component of that program.
Yeah, it is, and even in the engineering programs that are not, people are not going to see it's still a basic part, so all our students, I would say, without number, will know that basic first aid.
Yeah, but I think, Caroline, I think your programs are quite specialist, and I'm not sure that it would happen for kind of run-of-the-mill, so business studies degree. Do they cover basic first aid?
It probably won't. It goes back to a particular hobby horse of mine, and I think it should be taught in schools as a compulsory subject. So consider it as well. And during induction week, even a half-day basic first aid course, I don't think that would be amiss in a freshers week or something. Perhaps something to consider.
It certainly is, Caroline. It's I'm working on induction materials at the moment. It's given me something to think about, actually. Yeah. Just thinking, Anne, from a Murray perspective, first aid and students?
Seems like a good idea.
It's not something that happens at the moment?
No.
No. It really has set me thinking, actually. You mentioned, Paul, you mentioned about students who are, maybe they get anxious or get slightly depressed and they miss their studies for 4 or 6 weeks, and the possibility of catching up becomes more and more remote. We do have a mechanism for dealing with that, and it's called suspension of studies, so where a student would actually suspend their studies for a period of time, usually a semester, and then pick up the studies the following semester. Doesn't always work, but it is a mechanism that we do have in place to support students. Right.
The other, is there a system of tracking who's using the library and who isn't? Like, does that get recorded?
I'm not a librarian, and I don't know the answer to that one, about whether they're tracked with the library. Certainly a personal academic tutor would be informed if a student has disappeared off the radar.
Yeah, because I know a couple of years ago I actually did a online nursing and midwifery module, University of Stirling, in ADHD, and what they had is a kind of way of tracking how many hours of online literature reading you were doing from their literature database. Right. And if you hadn't logged on for a week or two, it spotted it, and right. Potentially that would be a mechanism of feedback. So I'm wondering if something simple like that might be a way of, because there must be all kinds of things students need to log on to check on a fairly regular basis.
Well, yes, there's email obviously. There's also the virtual learning environment, Blackboard, that we use. If a student isn't contributing to a study group within Blackboard, then that would be picked up.
But I think
But yeah. there are always some students who will slip through the cracks.
Yes. I think the important thing is probably to help other students realize that they have a collective responsibility for their friends to kind of get them help early if they think their friends are slipping.
Any other comments or questions?
Yeah, can you hear me?
Yep.
Yep.
There's also early intervention scheme at Murray, so if a student hasn't been attending, it gets flagged up, and if they happen to have a support plan, we get invited in to see if it's got anything to do with their disability or difficulties. But I'm not sure if that's HU. Is that, you think it's FE? I think it's just in the FE.
Right.
Uh-huh.
I think the other thing I haven't really been able to touch on is people that have mild Asperger's syndrome, which is a type of autism. And some of these people are incredibly talented and intelligent, but socially disconnected, and they may be in programs but be quite isolated socially, and so that, you know, they're sort of perhaps at easier risk of slipping through the net if they're not coping with something. The trouble is, you know, even in the NHS, services to help people with Asperger's are not well developed in Scotland. It's complex, but I mean, part of the reason is that it's like a kind of personality style, and there's not actually a whole lot you can do to change it. You know, if you've got it, you've got it, and that's the way you are. But I mean, obviously, you're at more risk of getting depressed. You're at more risk of getting into social isolation. So these people have special challenges that might flag them up in a student environment.
I've come across that within computer-related programs, computer programming. Yeah. Okay. Any other? No other comments? No other questions? No. Okay, Dr. Sheard, thank you very much. That's been very informative, and nice to see the technology working from Tyree all the way up to Shetland and beyond.
It is. Okay, well, thank you for giving me the chance to speak, and I hope other students will listen in the future and get a bit of benefit, a few tidbits out of it. Will.
Yeah. Okay, thanks very much.
Okay.
Bye, everyone.
Bye.